Great. So as I mentioned, we have Richard Kollodge here from UNFPA, who will brief you on the UNFPA's 2017 State of the World Population Report. Richard, welcome back.
Thanks, Stefan, and thanks to everybody here. When you hear the word inequality, you probably think about money. Who has it, who doesn't, who has a bigger or smaller share. And it's no wonder, given all the statistics we see every day about how skewed economic power is becoming around the world. Well, here's another example, this one from the new UNFPA State of World Population Report. Today, the combined wealth of the world's billionaires, there are 2,473 of them, is equivalent to the combined gross domestic product of 4/5 of the world's countries. But while inequality among countries is generally narrowing, it's generally worsening within countries, and particularly among developing countries. Extreme inequality is bad for many reasons. It constricts economic growth, it stifles people's capacities, it distorts political power, and it can even lead to instability and violence. But as this new UNFPA report shows, inequality isn't only about income or wealth. Inequality is a much more complex phenomenon reinforced by diverse forms of disparity. For example, between the sexes, between races and ethnicities, and between urban and rural residents. Inequality has many dimensions, each a symptom and a cause of some other inequality. One dimension of inequality that's received too little attention is the enjoyment or the denial of reproductive rights and the effect that has on all of humanity. It's this inequality in reproductive health and rights that's the focus of this year's State of World Population Report. Economic inequality divides countries into haves and have-nots. Inequalities in reproductive health and rights divide people into cans and cannots. A woman or even an adolescent girl who cannot enjoy her reproductive rights is one who cannot stay healthy, cannot complete her education, cannot find decent work outside the home, and cannot chart her own economic future. Consider this. In most developing countries, the poorest women have the least power to decide whether, when, or how often to become pregnant. The poorest women also have the least access to quality care during pregnancy and childbirth. This inequity has lasting repercussions for women's health, work life, and earnings potential, and for their contribution to their nation's development and to the elimination of poverty. An unintended pregnancy, for example, can set in motion a lifetime of missed opportunities and unrealized potential, trapping a woman and her children in an endless cycle of poverty. As you know, the United Nations Sustainable Development Goals aim to build more equitable and inclusive societies and to achieve shared prosperity. This new UNFPA report argues that these goals, especially the one to end poverty, may never be achieved without first tearing down economic, social, geographic, and other barriers that hundreds of millions of women face every day in exercising their reproductive rights. This report is careful to note that you can't fix economic inequality just by fixing inequalities in reproductive health. However, the report does make the case that progress towards economic equality is possible if you make sure that all women have the power, the information, and the means to decide whether, when, and with whom, and how often to have children. Thank you. I'm happy to take some questions.
Thank you. Joe?
Yes, Joseph Klein, Canada Free Press. I want to ask this question. I'll try to do it as diplomatically as possible, but given the controversy surrounding some of the definition of reproductive rights. So I'm just going to ask you if you can provide, from your perspective, a more detailed description and example of what you would consider the exercise of reproductive rights and whether that would include access to abortion. Thank you.
UNFPA advocates for the availability of family planning to avoid unintended pregnancies with the aim of avoiding abortion.
Evelyn?
Yes, thank you. Evelyn Leopold. How much has how much damage has the U.S. financial withdrawal caused you, based on what I could only call alternate facts?
Well, the United States in 2016 contributed $69 million to our programs at UNFPA. That reduction in funds, because the United States has discontinued funding UNFPA, is affecting the health and lives of thousands of women. In 2016 alone, we estimate that U.S. money helped avert close to 1 million unintended pregnancies and avert about 2,300 maternal deaths. So any reduction in funding for UNFPA has a direct impact on women and adolescent girls in developing countries.
Matthew?
You have to read the report, but on this same topic, just because the new executive director, Ms. Canham, she had said that the Trump administration's decisions are unfair. This is a quote from her in introducing the annual report. But the number in the article is that UNFPA now faces a funding shortfall of $700 million by 2020. And I just wanted to know, maybe whatever you can say in terms of the actual plans to either raise that money from other sources, have other countries step forward, or to reduce operations. What's the plan to address this shortfall?
Yeah, I'm not really conversant in that, but I'm happy to get back to you afterward. If your question is, what are the plans for moving forward given the U.S. funding cut? I can follow up with you afterward.
Thanks a lot.
Okay.
Any other questions?
Yes, I do. One of the goals of UNFPA is to provide the means for contraception. How many people are getting it, and how many people do you think need it? There's always seems to be a diversion between those numbers.
Well, contraceptive prevalence has increased dramatically over the years, and I can give you the exact numbers afterward about how many contraceptives and in various types we supplied in developing countries in 2016. For some reason, the number 200 million male condoms, for starters, sticks in my mind for 2016, but I can verify that figure for you afterward. But nevertheless, there still remains an unmet demand for contraception. And I think the latest estimates are that 214 million women and adolescent girls around the world still have an unmet demand for contraception. And UNFPA has just approved a new strategic plan, and part of that plan includes 3 what we call transformative goals, and one of those goals is to eliminate all unmet need for family planning by the year 2030.
Joe?
Yeah, I just want to follow up on my question earlier. You had said that the objective is to facilitate family planning in order to avoid the need for abortion.
Mm-hmm.
But if a situation should arise where preventive measures have not succeeded and there is an unwanted pregnancy, does your organization view abortion as a valid tool in the context of what you said was to allow women and girls to plan their own futures and make their own decisions regarding reproductive rights?
For starters, UNFPA does not support abortion as a method of family planning. And the UNFPA position is that where abortion is legal, it should be safe. And where it's not legal, post-abortion care should be available to everybody to save lives. I don't know if that answered your question, but that's the UNFPA position. We do not support abortions in developing countries. Decisions about abortion are the sole domain of national governments.
Thank you very much. Richard, thank you.
Thank you.
Sorry, keep you waiting.
Thanks for the opportunity.